In some parts of Boston, newly increasing concerns over the spread of COVID-19 overlap with other challenges. These include everything from racial and economic barriers to the ongoing struggles with opioids. A critical response to those problems can be found in Roxbury at the Whittier Street Health Center. To tell us how it's providing help is the health center's president and CEO, Frederica Williams. Thank you very much for joining us again, Frederica.
Thank you for having me.
Frederica, start by telling me about the part of this pandemic that you're very focused on right now in the city of Boston, the areas where there has been a significant increase in the infection rate.
Chris, thank you for the opportunity. As you know, we've been providing on-site COVID testing and mobile testing where we go to different locations every day. And we also have been following the data from the Boston Public Health Commission. And based on recent data, we're seeing a spike in the infection rates of the younger brown and black population residents in Roxbury and Dorchester. So what we're doing in partnership and sponsored by the Mayor's Office of Health and Human Services, we will receive data from the city, the Boston Public Health Commission, and we're significantly expanding our mobile testing. So beginning on Tuesday, October 13th, we'll spend 10 days at the Kroc Center providing free testing to anyone who shows up, regardless of whether they have insurance. It's going to be free. And the idea is to get everybody tested, but also to get everybody educated about prevention and how they can continue to be safe. The pandemic is still here. There's going to be a surge. It's going to be a difficult winter, so we need everyone to be tested and to continue to be safe.
Now, one thing about younger adults that I would hazard, and this is from people of many different walks of life, is if they're healthy, they're under 30, they don't think this is a big problem. They wonder, why should I get tested? It couldn't be that serious. But what do you say to somebody who thinks like that?
This is something that as a CEO of a large health center serving 30,000 people, but as a mother of 3 young sons that are in that age category, there is sometimes that sense of invisibility. We were all there one time, and the pandemic has dragged on a while. There's a lot of uncertainty. I have a young son who graduated from college last year. There's just so much uncertainty, so much social unrest, and people are getting tired. And our job at Whittier Street Health Center is to focus on wellness and prevention. Whether we're talking about diabetes or hypertension or COVID-19, it can touch you at any age. As a matter of fact, when we first started testing, we were only testing 18 and older. And then we expanded it to 4 years and older. We started seeing a large number of younger children, as young as 4, multiple children in families testing positive. And it's because people live in multi-generational homes, in homes where they're not able to socially distance. But we've been able to contain that younger population, but we continue to be worried about them as they return to school. But for that 18 to 30 age group, we really need to do a lot of work educating them. It's good to go out and protest, but you need to be safe. You need to wear your mask at all times. It does impact people, even though we've seen that the mortality is mostly for older people with health conditions. We've also seen a lot of younger people that have died. The CDC put out data that children about 550 children under the age of 18 have passed away, brown and black children. And we have seen people in that 18 to 30 category that have passed away. But in addition, we're hearing about the disability that the virus can cause. So even if you don't pass on, think about the health impact. And also think about your grandmother, your mother, and the other people in your community that you're exposing the virus if you're not careful and cautious.
We have heard a lot in the most general way about young people having parties, but young people do other things too that could put them at risk, just going to work or riding the T, isn't that correct?
Yes, it is. And also young people that are essential workers, young people that have to work, young people that live in multi-generational home, So I guess the message here is the consistent focus on staying safe. Wear your mask, socially distance, don't be congregating in large groups or large parties inside or outside, and hand washing. And once you get tested, that is not a passport for life. You could be negative today and catch the virus tomorrow. So they are, they're going to colleges, colleges, campus, being exposed to the virus, they're interacting with their friends. So it's not necessarily just going to parties, it's just living everyday life. Like you said, on public transportation, interacting with family members, interacting with people you don't know. You don't know their status.
But
So
one thing is important, I think you want to get across, is that this testing is free and you're trying to do it in places where it's easy for people to show up too.
yes, we want to do it in places where it's easy, it's close to public transportation. We also want to do it during the hours that people can get to. So we've kind of staggered the hours later in the day. We will start testing at 10:30 to maybe 7 p.m. Also testing all day Saturday because we recognize that people have to work. So that's the mobile testing that will start off at the Kroc Center. We also have testing on site at 1290 Tremont Street in Roxbury. And there are also, if people should go to the mayor's website, there are other locations where people have been tested, and the mayor is supporting this expanded testing such that insurance is not a barrier to getting tested. And when we test, we will also be sharing educational information because we want people to continue being safe.
Well, you're contending with these disparities in the effect of COVID-19 by race and income, but there are other things going on, some of the side effects, let's say on mental health. You are gearing up for that. What does that mean exactly?
Yes. So what we've seen, people have been under a lot of distress. What has been eye-opening for a lot of people, but that we've known, our focus has been around addressing health disparities, social justice, and the economic inequities. If you don't have suitable housing, if you don't have transportation, if you're food insecure, if your mental health and your overall health is not stable, that impacts your overall health. And what we've seen, again, the uncertainty, people being isolated, socially isolated for long periods of time, people losing their jobs, people dealing with racism and discrimination, people dealing with evictions and homelessness. It's just added a lot of mental stress. We all need psychological first aid. And for a population, the brown and black, that have always been vulnerable and marginalized, we're seeing the rates of mental illnesses increasing. So what we're trying to do is to remove the stigma. If you're suffering from trauma, anxiety, or depression, there is nothing to be ashamed of. This has been an extremely stressful time, and we all handle stress differently. So we've established 2 gender-specific groups to address specifically trauma in Black and Indigenous people of color. We have the group for women that is focused on building that foundation of resiliency and fortitude, and a group for men. And they are meeting on Saturdays. We have the schedule posted on our website. They're meeting on Saturdays at the health center, small groups of less than 10 people that will all be wearing masks, socially distanced, and so that we're complying with the CDC guidelines. But it is important for us to focus on our mental health because it impacts your overall health. If you're suffering from depression and you have diabetes, you're not able to care for your diabetes because your depression is impacting your mental state. And we're just seeing high rates of post-traumatic stress disorder, high rates of anxiety, and we are always proactive in looking at ways that we can support the community. We've expanded our mental health counselors of color, psychiatrists. Substance abuse is also another issue that we're seeing increasing because of just the uncertainty that people are going through.
I can imagine many of the people you described have tried to talk these problems out with family members or friends, and maybe they might feel they've exhausted the possibilities there. So if they join one of these groups and they can talk to somebody even remotely, what does that do for them?
First, you get in the professional help. It's wonderful to go to your clergy, to your pastor or your family member, but you want someone who has an objective perspective, someone who's trained on giving you the tools to be healthy, to be stable, to be confident, to be able to deal with all of these things that come at us. Stress impacts your health. It causes heart disease, diabetes, high blood pressure. So being able to work with someone who reflects the community we serve, who can relate, who has the cultural competency, but also the clinical skills in a non-judgmental environment is critical, but also being in a group of like-minded people. It becomes a community of support as well, in addition to the professional community support that you're getting from the counselors.
Well, finally, on top of everything else, a lot of us, just about all of us have to get flu shots, but especially if we're older and at higher risk. But how can people do that at Whittier? And is there any way they can find more general information about other things that you have going on?
So we've been hosting flu clinics in the evenings and weekends, and we are encouraging everybody, especially during this pandemic, especially around the predicted surge in the virus, and this being a terrible winter. The flu vaccine clinics, again, are free. They open on Saturday. I was here last Saturday and it was very busy. So I'm excited that people are coming in to take advantage of it. They can call 617-427-1000. That is our main number to schedule, or they could just show up. Same as the COVID-19 testing, people can call and schedule or just show up. We just want you to show up, get your flu vaccine or get your COVID test, but it is important. I did get my flu vaccine 3 weeks ago. I usually would wait until October, but I wanted to be ahead of the curve, and there's going to be a huge demand. So we need to move quickly and act swiftly so we can be safe and continue wearing our masks.
And people can also check out your website, is that correct?
Yes, wshc.org. We have the information. We have the schedules of all our mobile testing. We have the schedule of our flu clinic and also the schedules for our on-site COVID testing and these programs that we just discussed.
Well, thank you again very much for taking the time to join us.
And thank you for the opportunity. Stay safe.
Yes, you too. Frederica Williams from the Whittier Street Health Center in Roxbury. We'll have more news in just a moment.
Thank you.